A direct fabrication of the resin-bonded bridge. A preoperative facial view of the edentulous region of the maxillary anterior segment. A diagnostic wax-up was designed to establish parameters for tooth position and alignment, restoration shape, physiologic contour and texture, occlusal function, incisal edge position, and gingival orientation. A clear vinyl polysiloxane impression, Exiclear by GC, was taken of the diagnostic wax-up using a clear, non-perforated plastic tray. A small opening is made on the lingual aspect of the matrix in the region of the maxillary left and right central and right lateral, with a tapered diamond burr, a number 6847 by Brasler. It is important to clean the internal surfaces of the impression and the orifices with an applicator tip to prevent silicone debris contamination of the composite material. A comparative photograph was taken of the selected shade and opacity using the flowable material Genial Universal Flow. A 2 mm gas plasma coated fiber, Ribon THM, was selected, measured to span the edentulous region, and cut with a supplied shear. The reinforcement fiber was coated with an unfilled light-curing resin bonding adhesive, DE Resin by Bisco. The excess adhesive can be absorbed using a 2x2 lint-free gauze. The reinforcement fiber was placed over the edentulous region and secured to the lingual surfaces of the maxillary left central and maxillary right lateral by spot bonding with a flowable resin composite, and the entire reinforcement fiber was light cured for 40 seconds. The clear silicone matrix was placed over the edentulous maxillary segment, and an opacious A1 shaded flowable resin composite, Genial Universal Flow by GC, was initially injected through a small opening above each tooth, followed by mixing with a B1 shaded flowable resin composite using the inverse injection layering technique. The resin composite was light cured through the clear matrix on the incisal, facial, and lingual aspect for 40 seconds respectively. The composite sprue was removed using a tapered finishing burr, and the resin bonded bridges gently removed from the teeth. The borders of the resin bonded bridge are smoothed and polished with finishing and polishing disc by Brasler. The completed fiber reinforced resin bonded bridge after adhesive cementation. This can be spot bonded as a provisional or completely bonded as a final restoration. Another restorative approach is placing a veneer preparation on the composite central incisor, taking an impression, and having the laboratory fabricate a porcelain veneer which can be bonded to the substructure with flowable resin composite. In this clinical situation, the fiber reinforced resin bonded bridge was bonded with a flowable resin composite as a transitional prosthesis during implant therapy. The patient was pleased with the aesthetic result of the provisional during the healing stage using this injectable resin technique.